At this meeting, I presented the long-term efficacy data of the ELM-2 study arm for follicular lymphoma patients, which has now been presented with new follow-up data. The ELM-2 study is a multi-arm study of Ordronextamab single agent for the treatment of relapsed refractory lymphomas. One of the arms of the study included only follicular lymphoma patient relapsed refractory after at least 2 prior lines of therapy. The study was initially presented a couple of years ago and published last year in Annals of Oncology, showing high activity in terms of response rates, efficacy in terms of progression-free survival, and with safety details that are in line with observed with other bispecific antibodies. This preliminary initial data allowed for the registration of Ordronextamab for the treatment of relapsed refractory patients with at least 2 prior lines of therapy in Europe. The present update shows additional details about the follicular lymphoma arm of the M2 study with longer follow-up. So the M2 study investigated single-agent Ordronextamab, which was used IV until treatment progression or toxicity with an initial step-up dosing that was updated for as a 3 weeks step-up dosing after the initial 2-week dosing in the initial design of the study. The primary study endpoint was overall response rate. Overall, 128 patients were enrolled, showing the features of high aggressive disease and high-risk disease as expected for relapsed refractory patients. The response rate were, if I would say, better than the original reported data, with a CR rate of 74%, which is the highest among the complete response rate of other bispecific antibodies in the same follicular lymphoma setting, with an overall response rate of 80.5%. In terms of efficacy, the median progression-free survival was also improved compared with the initial report and was described as 23 months, being longer, 34.5 months in the median duration of PFS for patients who were able to achieve a complete response after the treatment. The median overall survival was also excellent, being reported at 54.2 months overall, again, with better results when the overall survival was only observed for the patient who achieved complete response rate. So in terms of safety, no new signal was observed compared with the primary analysis. CRS was confirmed as being the most frequent adverse event, which, however, was reported being grade 1 or 2, and mainly limited to the first cycle step-up dosing of the treatment. Other safety signals were consistent with the original analysis, with significant number of patients who experienced treatment emergent adverse events, some of which were also associated with treatment discontinuation. And in 20 cases, the treatment emergent adverse event was also associated with death. However, out of these 20 patients, only 5 treatment adverse events, which was leading to death, were associated with correlated somehow to the treatment, with only 1 additional case compared to the primary analysis. And looking at the quality of the events, the most relevant, clinically relevant event in this case was that of infection. We have to say that the M2 study enrolled patients during the very hard time of the COVID pandemic, and actually 32.8 patients experienced a COVID infection, which was, however, severe only in few of them. No ICANS were reported in this study. Only 1 grade 2 event was described, but the study actually confirmed that ICANS is not an event which is associated with the use of bispecific antibodies. So, in conclusion, also this long-term follow-up of Ordronextamab for the treatment of relapsed refractory follicular lymphoma patient confirms the very high activity and efficacy of the treatment that is consistent with the prior data, even but with a longer follow-up. and the safety profile was generally manageable. Overall, all this new data confirm that Ordronextamab has a very promising activity and a promising role in the future treatment landscape of follicular lymphoma patients and another lymphoma, but in particular in follicular lymphoma patients, this data strongly support the rationale for conducting additional studies, mainly in combination regimens, and there are actually at least three studies in the Olympia program, which are testing Ordronextamab in combination alone or in combination with lenalidomide or chemotherapy, with chemo-free option in the relapsed refractory setting, but most important with immunochemotherapy in the newly diagnosed setting, allowing to foresee that if this trial would be positive as expected from the initial design, initial hypothesis, Ordronextamab will contribute significantly to reshaping the treatment landscape of follicular lymphoma patients.